When it comes to youth mental health, access to health care remains problematic in the state. The Idaho Behavioral Health Council recently drafted recommendations on behavioral health, many of which revolved around youth mental health care. Idaho Reports visited Health and Welfare's Region 2 of Idaho, which included Idaho, Clearwater, Latah, Nez Perce, and Lewis counties, an area that provides a unique set of problems ranging from connectivity to a lack of available providers.
It leads us to having longer waits to get into treatment, which, is a compounding problem. If you are currently experiencing a mental health issue and you need treatment and you're not able to access it for 6 weeks, sometimes those issues can compound and become more of a crisis. And then you might end up in the hospital. And so sometimes hospitals get backed up, and then, it's just getting access to the appropriate level of care can be really difficult in the time when you need it.
In Grangeville and across Idaho County, the shortage of providers is even more noteworthy.
I think we are in Grangeville, and our surrounding area is one of the few places left in Idaho where we don't even really have adult crisis services closer than Lewiston. We certainly don't have any youth crisis services. And then, of course, if someone is suicidal, in crisis, needing inpatient care, that's very difficult to access here.
The state does use telehealth, but that's not an option for all Idaho families.
I just don't think there's any way to understate how long geographic distance impacts healthcare. Not just mental health, but we're specifically talking about mental health. So the idea of telehealth is fantastic. It's not fantastic if a family doesn't have access to internet, right? Service provider. And there's a lot of places in Idaho County where you just can't get service, period.
The sense of independence across rural Idaho has both pros and cons.
On one hand, it's super positive that I think in Idaho we love to work hard and we love to accomplish things on our own. And that drives our productivity and our pride in our communities and ourselves. On the other hand, I really think there is a skill deficit in being able to ask for help when you need it. Nobody knows everything. Everyone needs help sometimes. And to know how to ask for help and to actually ask for help, I think is something that we struggle with.
Peer support specialists are one of the best tools Region 2 uses amid a shortage of healthcare professionals.
The peer will work with and help the family advocate and know and be able to navigate the system. Navigating the system is one of the most complicated pieces to the puzzle sometimes. Knowing who to call, who to ask for help, where to go can be one of the biggest barriers for families, I think, in accessing the services that they need. So a peer will help walk them through that. A peer has also experienced either a mental health or a substance use issue, or had a child with a mental health issue in the past. And so they have firsthand personal knowledge and experiences that they will offer and provide. And so they have been really helpful in personalizing the treatment that we have.
The Idaho Federation of Families for Children's Mental Health works with Idaho families in need of resources for their children.
When a youth has a serious emotional disturbance, there are a variety of resources that are needed. So counseling once a week, even twice a week, is frequently not going to be enough to help that youth. What we are facing a shortage of in Idaho is the more intensive community-based services. We don't have the workforce for it. We just don't even really have the infrastructure of that built out yet.
Her concern revolves around youth with serious mental illness and the strain that puts on families.
People are faced with, okay, my child is out of control. They may harm themselves. They could harm us. They could harm a family. They're just a friend. They're just simply not in control of themselves. And there are very real reasons that have to do with mental illness where you cannot simply talk a person back into, hey, get control of yourself and let's do this differently. So you have to have some resources at that point. When you arrive at an ER because you are very scared that your child is going to harm themselves or your family is not safe, your family environment is not safe, it's just awful when you sort of are turned away because this child is medically stable. I'm not sure what you want us to do about this child. Do you need to call the police? I mean, typically that is the decision that parents are making from their home. Do I call the police because things are dangerous, or is there help for me at an emergency room? There are just some really dedicated people in very small numbers trying to cover a big population. I mean, Idaho is somewhat sparsely populated compared to most states, but if you look at the amount of workforce compared to the amount of need, it's staggering. And there's a lot of youth and adult need in Region 2. So you've got people stretched really thin, and you've got families who have both adult and youth need, and that really can compound the issues in a family. So I think the best thing we could do for Region 2 is help them get more workers there. And we need to do that all over Idaho, but that's definitely something I'm concerned about for Region 2.
There is a system of care in place through Youth Empowerment Services.
So people are working very, very hard to try and make the system better. We need a workforce desperately. We need people to understand that it's a slow journey to where we need to get. So we need as much compassion and support around families while we don't have all the resources in place.